There have already been organized 6 international congresses in Hungary dealing with people who live more easily with these physical means for vascular therapy.
It's a great pleasure for us to accept participants in the 6th International Bemer Congress from as much as 21 centuries. Therefore, it's 350 people who will listen to the results of the latest research promoted by Bemer during the 2 days.
There is one word that is common on all the devices.
I was very skeptical at the beginning, but that was really what convinced me, my own experience, and so I really love to share it to everybody. Just try it, give it a try.
Summarizing results of the scientific research and clinical experience, I can say that at present the Bemer therapeutic system is unique in the world in the field of physical vascular therapy.
This mother is just showing the functioning of the device well discernible with its orange letter M to her daughter. It is not rare with the Bemer subject advisors that the expertise remains within the family.
Yes, she is my daughter. She is interested in it, and it is she who uses it within the family. I hope that the scientific program will also hold her attention.
At present, we take part in the scientific program of the Bemer East Europe. This is the 6th International Conference Budapest, examining the physiological effects of the Bemer vascular therapy. Bemer therapy has already been known and used by the majority of the participants.
I will have a better mood. I can bear daily activities better. My thinking is fresher. My general conditions are better. I treat myself regularly at home as well. I have my own device. We have used it for 3 years already.
Bemer therapy has been existing for 15 years. It has been available in Hungary for 12 years. The therapy will stimulate the movement of the system of small vessels. Namely, it will stimulate the rhythmic pulsation of the walls of small vessels. With this activity, supply of cells with nutriment and emptying their roughage are supported.
All professional fields have been interwoven quite seriously by today. When we started our activities 15 years ago, it was very difficult to be accepted by medical professionals. But in this series of years, after the appearance of our results and experimental research, we started to receive more and more invitations from the different medical professional societies to their congresses. In the meanwhile, we began to organize such thematic conferences like this present one. In these congresses, we are summarizing the results of the Bemer therapy only. With these Bemer days, we address not only the universal medication, but the holistic medicine and other therapeutic measures as well. Our therapy is not a palliative way of treatment. With improvement of the normal nutrients and emptying roughage, it improves other regulating processes like the activity of the immune system as well. We support the fundamental part of the activities, and all the other circles will work in the way nature has planned.
Verification of the efficacy of the Bemer physical vascular therapeutic system is facilitated by 2 everyday experiences. One of them is when somebody starts to use the devices at home, he or she will generally never stop their using. The other is the fact that the therapy has an extraordinarily great variety of utilization possibilities.
So as an example, you are a diabetic and you have a typical diabetic leg, a black leg, an ulceration and so on, and you're gonna take medication to help there. The medication has to go there. But the problem is microcirculation does not work there anymore. So the medication cannot be transported over there. So the first step what you have to do is improving microcirculation. That medication, as an example, can work over there. And that is what we do. So that is a synergy, an absolutely synergy.
Most of the participants in the Bemer conference are physicians or subject advisors also using Bemer therapy.
This is a supplementary treatment at home. Therefore, if I advise somebody to buy because it will help him or her at home, this means there is a consultation between us. We control the results, we will ask reports, so I will keep holding the hands of the patient. And I will not ask him or her just to lie on it and wait what will happen.
Guten Tag, meine Damen und Herren.
This modern vascular therapy was developed by the intellectual father of the Bemer therapy, Dr. Rainer Klopp, assistant lecturer, head of the Berlin Institute for Microcirculation. The secret of the procedure is the fact that the periodic movements of the little arterioles and the venulas can be drawn near their ideal state with a special signal configuration, being the effective component of the Bemer therapy. This signal is placed into the organism with the help of a low-frequency electromagnetic field.
Little capillaries cannot be influenced by medicaments. Physical effect can be exerted on these sometimes narrowed capillaries only with the Bemer therapy. Let us see, for example, the stress concerning many of us. When stress hormone develops in the great veins, these will be narrowed. This can cause disturbances in blood supply or tissue lesions as well. In the same time, capillaries treated with the Bemer vascular therapy can compensate stenosis of the great veins successfully. This is a great result.
The Bemer vascular therapy increases natural pulsating motion of the capillaries, that is, it stimulates vasomotion. It improves circulation at anywhere in the organism, even if we go in for sports or we do not have the possibility to move.
Because I am a physician and I'm interested in it. This is my mentality to pursue some sport and to consider natural healing ways important. Therefore, we suggest kinesiotherapy and other natural courses to our patients. Of course, these principles are confirmed for me by a professor's report about scientifically proven facts. I think that focusing to nature could be very important in this medicine-oriented world. We physicians know well that at present therapy is directed mostly by this mentality.
The Bemer therapy is applied at outpatient departments, at healing centers and at home as well. It can be managed both by physicians and representatives of the alternative medicine.
I'm not a physician. I deal with the mental background of the illnesses, and besides, I have been dealing with the Bemer therapy for more than 9 years. Bemer is a real love for me, providing me with many experiences. So it has become possible to help beyond the limits of traditional medicine. It is very important to me, and I'm very grateful for these experiences and for the possibility of helping people coming to us for devices.
Let's go back to that lady doctor who was explaining operation of the Bemer devices for her daughter.
This is a mattress. This is used for the treatment of the whole body, and this is its central part, where I can select programs. As a matter of fact, these two parts are important and necessary for general treatment, but there are some other training units for local treatment, namely the so-called scarf applicator or a disc-shaped unit to be applied to treat joints and other places.
According to the international databases, Bemer is the only physical therapy supported by international and Hungarian experiments. If you search in the web in the list of experiments and put the name of the patented method in, you can see the results of experiments performed under strict conditions. In spite of the fact that the therapy is 15 years old, it is still unknown for many experts.
Because it's a kind of an unknown technology, actually in the U.S., I don't think very many people know about it. But I've had it for 3 years, the Bemer. I have some people that want to know more information, so we'll have some meetings and let people know what kind of information we have here. I'm an acupuncturist, so I have a full-time practice in Seattle.
Worldwide we have more than 1 million Bemer users, but what I said was in Germany we are working with a little bit more than 3,000 doctors, universities and medical institutions. As an example, like the IPO, the International Prevention Organization, and so on.
Intellectual center of the Bemer method is Germany, but Bohemia, Switzerland, even Hungary can be counted as strongholds. The last conference was already followed by hundreds of physicians and advisors who were educated on the Bemer therapy in the course of the last 10 years. The theme of the opening presentation was surprising.
We must fight, because developing Bemer system is only the initial phase of success. Very good effects gained with vascular therapy are only the beginning. Today, a part of our research work is directed to know what others do under our colors. You, freeriders, do not have here anything to find. These are the devices number 1 and 2. No, these can be neglected. There is the Bemer instead of them. We have Terramagon and Magnet. You can see the impulsor, the Sentia Plus or the IMRS. The question is whether any therapeutic effects can be deduced from them or not. Well, the best results of the impulsor, the Centiplus or IMRS, will not even come near to those of Bemer. I must say that their results are not fully inefficient, but they are not enough.
Centiplus und IMRS und auch Impulser, naja, da ist ja ein bisschen.
Let me add, first of all, I would never buy such devices for a price sometimes as high as Euro 2000. In the same time, I dispute their therapeutic effects. The received values are too low to reach these effects. Results of our therapy significantly deviate from those of the others.
Das ist keine Frage, aber es ist zu wenig, einen therapeutischen Effekt zu begründen.
Imitators of the Bemer system wanted to develop the special signal having the same effects than those of the Bemer, but it was not successful. But in this case, they would have violated the patent protecting Bemer. They would have done it because we have not found any other ways to get the same effects. As a scientist, I cannot exclude the possibility for another way to exist. But I do not know any such ways.
In Hungary, we are having more and more such devices together with many other things overstocking the market. It started with Bemer, and in the same time people sensed business in it and started to manufacture many kinds of magnetic devices. The text then is to sell them.
Unfortunately, in the past 1.5 years, we have had many feedbacks, especially from our patients, that people try therapeutic systems with therapeutic effects almost equal to zero. These aroused the interest of professionals in Germany who examined devices best known and most frequently sold in Hungary as magnetic therapy systems. Practically, there are several therapeutic systems to be advertised as devices for magnetic therapy, but they have the effect equal with the level of biological noise. So these results are very shocking and in the same time unethical, because we are having feedbacks about the fact that the other companies utilize the scientific achievements of the Bemer therapeutic system.
Sometimes they make connections with me. Moreover, there are companies showing my presentation without informing me of the company or of the place. As summarizing, the Bemer therapy can be fully separated from the other devices listed by the professor. By stimulation of a very important part of our circulation, the lily veins, our professor says, the arterioles, venules and capillaries for better metabolism and for stronger immune system, we can reach very special effects, not verifiable by any other devices.
In the same time, the authentic Bemer procedure is an excellent supplementary to medical therapy.
I would say also in an acute situation, medication is really necessary and important. And I really want to state that out, that we are not in any competitive way to any medication. Medication is very necessary, but what we can do is can improve, let me say, the ankle.
This was supported by the most interesting presentations as well. It was revealed that the president and director of the Bemer International AG, father and his son, can imagine great things about drag as well.
The aim of our research was, in fact, it was the question, or we were asked by Bemer to do it, if there is a synergizing effect between the drug, anti-cancer drug, and Bemer effect. And it was interested, as it was interested from the scientific point of view, we agreed to do such a study, and it was a good study.
A lady professor invited from Bohemia, a microbiologist, evaluated the effect of the Bemer therapy on experimental healthy animals and on those with weakened immune system. The results were surprising even for her.
A little bit surprising was that the new mice, what means mice with immunocompromised immune effect, means they are mice which are not so able to respond to environmental microbes, respond better to Bemer than conventional mice. What might be a good message for those with immunocompromised immune system?
On the basis of the lecture of the physician trainer from the Mother Institute in Liechtenstein, besides the fact that they could mix Bemer with other therapies in an excellent ratio, it was also revealed that the internist is a Bemer patient as well.
The best thing is what I experienced with Bemer, and what was also the point what convinced me. I'm a chronic pain patient for more than 30 years. And the last thing that I didn't was operation, undergo surgery. I have a severe scoliosis, I have a hip impairment, and I was eating painkillers. And after 2 years of Bemer, now with the treatment, I use the same dose that I used to eat, to take for 1 week, now for the whole year. And that is what it makes so effective. It doesn't prevent you from taking painkillers, but you can really reduce the dose, and that is going on with life quality, and it's also a preventive act.
In her lecture, a dermatologist reported that she also healed her family members with the Bemer devices. For example, she healed her husband, an oncologist, who had been bit by their dog.
Okay, this is beautiful now and cannot be recognized easily, but it had been in splints for 5 weeks and I had to go for exercises for a period of 5 months, so that I could use it. Now it's working mostly. The situation is that my wife had been dealing with Bemer long before this event, and on the basis of the microscopic pictures of capillaries, I had always believed that it was able to improve microcirculation. So it was not necessary for me to be convinced.
If physicians treat each other with the Bemer devices, this can also prove that there can be something in it. Is it not true?
I am a dermatologist, so I deliberately didn't choose cases from my profession, because of the fact that I have treated many patients already who became better after using the Bemer. Concerning people in my family and among my friends, I can say that they think similarly, and it doesn't come to them to go for the solution very close to them. I would have liked to say as a motto that when being in troubles and after trying everything, and when nothing helped, it must come to mind to go to the cupboard and use Bemer.
Lecturing vascular surgeon suggested his patients that besides using Bemer therapy, they should change way of life if they want to become healthy more quickly.
In my practice, I have recognized that hydration is very important, so drinking fluids is very important all day. The amount of daily intake of water is calculated according to the body weight, and for patients with vascular disease, it is 1 liter per 25 kilogram body weight. So a patient with body weight of 75 kilogram must drink 4 liters per day. This is very important. Patients receive mineral water before and after treatment. So it is compulsory to have fluid intake into the organism. And for example, limping patients after treatment must immediately go for a walk. So they must not sit into the car and drive home to drink a glass of beer and to watch football match. They must walk a minimum distance, I expect.
Másrészt lehet vérzéses eredetű is ez a
The neurologist discovered the beneficial effects of Bemer therapy during rehabilitation of cerebral vasospasm.
This device can also be recommended in the rehabilitation of stroke. Treatment can be started some days after stroke, and it can also be successful even after 18 years to alleviate remaining symptoms.
Rossz vaszkularizáltságú szövetnek egy jobb vaszkularizáltsággot.
The lecture hall with the seating capacity for 400 persons was really upset hearing the positive clinical experiences in the treatment of infertility.
Azt gondolom, hogy azért is mozgatott meg mindenkit, mert nőkről volt szó elsősorban.
The lecture hall was so upset because there were mostly women in it. But putting aside the joke, common denominator of the device in different pathologies is surely its positive effect on the blood flow towards tissues, which can indirectly influence a specific illness, for example, fertility. Efficacy of the Bemer therapy in this process is developing very quickly, playing a proven role in basic research on microcirculation level.
Besides the development of Bemer therapy, the Bemer family members open more and more widely their possibilities for those interested in healthcare who later become Bemer advisors, many times supported by their own therapeutic experiences.
I met the device many years ago. We started to use it to treat my grandfather, who suffered from a serious vasoconstriction. He had to have one of his legs amputated, and about 5 years later he was said he would lose his other leg as well. In the family, we started to look for another solution, because my grandfather told he didn't want to live in this way. And it was my mother who found Bemer first. We borrowed the device and my grandfather started to use it. After some days his pains decreased. His leg started to become warmer and he already believed in the device. Moreover, he said he insisted to it and he wanted to have it. So we bought it to him. Noemi is 8 years now. She was born with quadruple X chromosome disorder, which is very rare in our country. Practically, the number of families having a girl like she is between 10 and 20, so we keep contacts. Related to this anomaly, we had impairment of hearing, and as its consequences, problems in development of speech, sleeping disturbances, heart surgery.
The Hungarian market is really working in the medical area very well. That is the reason why they can do each second year a huge medical congress with 300-400 attendances.
The consequence of the lectures is that the Bemer therapy is efficacious even to treat medical problems far from each other.
We would like to use Bemer device to treat problems of learning, improvement of the cerebral blood circulation, the better general circulation and the better oxygen supply will influence ability to concentrate, reception of information, elaboration of information and memory positively.
Bemer is successful both in the treatment of behavior disorders and in palliation of osteoporosis.
Therefore, it was not so difficult for me to talk it over with patients that I was not going to give them medicaments, but we would try a method without any drugs, which would improve locomotor disorders, would lessen other necessary medicaments, would strengthen immune system. It has not any side effects and practically has not any contraindications.
Would you please look at the following two photos? There is 1 week difference between the photos. If you compare them, I think 10 years difference can be observed.
It proved to be useful to seize dermatological complaints and in surgical rehabilitation as well.
Here you can see the tendency on the scale of pain according to the basic diseases. The red field shows the decrease of pain, so it can be seen that the range of scale is between 1 and 10, because patients tend not to choose the lowest or highest values. Those approaching 2 is very positive. You can see results after 4 treatments. I use Bemer to botulinum toxin treatment as well, because it gives more stable results. Pain tolerance is better. It helps to cease swellings. Now we can speak about Bemer treatment on the body, about local treatment and about the state before and after treatment.
It has been used to support cosmetic interventions, and it has eased rehabilitation of locomotor disorders. Moreover, the follow-up treatment of vascular surgery.
This patient is now without any complaints, and when I asked him about his state, he reported to me that he was all right without any complaints. He had already bought Bemer device from himself, so he could experience good effects of it.
You are introduced to a physical device that solves the problem of patients whose illness could not improve. Moreover, it was getting worse under conventional treatment. It's a great help for the physicians and treating personnel as well. The fact is that blood is taken away from critical parts of the body. When we start systematic treatment, it is very difficult for the medicaments to reach the most critical parts of the body, that is our extremities and our head. Therefore, if we start Bemer treatment on the most critical parts of the body, we decrease peripheral resistance that provides balance for all the body to start systematic treatment, which in this way will be more efficacious.
These were only a few examples to show the great number of investigations going on abroad and at home. However, the results as proven by this conference are encouraging.
Dr. Zacko, Anna Maria.
Dr. Zacko, Anna Maria.
President of Bemer International AG, in his closing remarks, emphasized work of the lecturers recognized with certificates, the professional level of the lectures, the constructive discussion and the interest of the audience.
I've been having close connection with the Hungarian representatives since the beginning, when of course my task was to help them in their first steps in order Bemer therapy should take a firm stand in Hungary. I'm very glad to see that we have reached so great and high-level development during the past years. Without exaggerating my praising words, I'm convinced of the fact that Hungarian people are wonderful and interesting. There are many highly educated and very intelligent people among my acquaintances in Hungary. Moreover, they can be characterized with healthy inquisitances as well. That is why they take part in trials with pleasure. In my opinion, this is the reason of the good results what we can see today, and I think it is great.
Hungarian organizers of the scientific conference were asked whether the Bemer devices will be competitive in the future as well.
The fact is that most of these patients don't live in good material conditions. It would be the best if the National Health Insurance Fund financed at least a part of the price of the device for these patients who are really in need of it.
It has come to my mind that I would be very glad if in 10 years most of the families had a Bemer device.
Role of Bemer is growing besides treatment of abnormalities in the prevention as well. It is important for everybody to keep their workplaces and to support their families, and to reach this goal, it is necessary to preserve their health. According to the scientific achievements, Bemer therapy seems to become successful in this field as well.
Danke, danke.